Hello and welcome to my live today. I'm so glad you could join me. If not, I'll see you, of course, in a little bit here through my replay. But let me just set this up really good so that I can see. Okay, here we go. So October is Mental Health Month, and I would like to highlight some tips that work in my practice here. So let's see. So many of you throughout life have experienced some, sort of mood changes, mental health issues that can impact your behavior and quality of life, whether that's grieving, depression, some sort of a short period of time. By supporting good overall health, like having regular physical activity, maintaining a well-balanced diet, making sleep a priority, and managing stress are some factors that can help to support really very well mental well-being. My motto, MEDS, if you can guess, you can let me know what you think this acronym means, because this is what I put on my wall. I'll let you know my little secret at the end of the video today so that you can have some time to think about it while we go through some of the notes here that I have. So let's see here. Okay, let's see. So some dietary supplements may help to support cognitive function, as well as address or prevent mental health conditions. As the sunlight gets less, we're going to fall and winter, some of us really have some sort of a sadness that come in during this season. So, I would like to highlight some useful information about top recommended supplements for mental health, including my popular products in my dispensary. Okay, so number one here I have is St. John's wort. I am sure you find that in any of the health food store now. St. John's wort is one of the most researched medicinal herbs, commonly used for mood disorders in herbal medicine and Chinese medicine as well. It's quite popular. So the plant's yellow flowers are used to prepare teas or decoction, or sometimes we put it in a capsule form as well. We formulate that into some sort of dietary supplement. Research has shown taking St. John's wort for individuals with mild to moderate depression has comparable efficacy and safety when compared to selective serotonin reuptake inhibitors, or SSRIs, which is a class of pharmaceutical antidepressants. However, St. John's wort can interact with other pharmaceutical drugs as well. Some of these include blood pressure medication. It will actually cause blood pressure to go high. If you're taking blood thinners such as warfarin, you do not want to take a St. John's wort. And also if you're doing or taking other mood regulating medication that is an SSRIs kind of a group, St. John's wort is not good for you. This compounds the effect of the serotonin production in the brain and will have some adverse effect. So considering this several pharmaceutical interactions with St. John's wort, it is best to speak with your healthcare practitioner before taking this supplement. And I see that most people just buy this from the shelf in the grocery store because they think, oh, this will help me. So be very careful and know that it has some adverse effects as well. Also, if you're taking St. John's wort, refrain from drinking alcohol and taking any foods high in tyramine, like aged cheese, aged sausages, fermented or pickled foods. So stay away from those. So top St. John's wort supplements I have here is by Herb Farm, and also enzymatic therapy, which is one of the popular brand here as well that I carry. Next, we want to talk about Bacopa, B-A-C-O-P-A. Bacopa monnieri is the name. It's also known as water hyssop or Brahmi in Ayurveda, which is the traditional system of medicine in India. Bacopa is a medicinal herb with a variety of properties. These include anti-inflammatory, analgesic, memory enhancing, sedative, and anti-epileptic effects. So research has shown that Bacopa can improve or may improve cognitive functions such as learning and memory, in healthy individuals, as well as improve concentration in individuals with mild cognitive impairment. So that's Bacopa for you. You can find them also in some of the health food stores. Are very easy to find. And it also helps to increase serotonin levels, a neurotransmitter that promotes relaxation in the body. Top Bacopa supplements that I have here, there are two that I like to carry. They are by Pure Encapsulation, which is physician-grade supplement, and also another one by Clay Labs also. Okay, so that's Bacopa. The third supplement that I would definitely recommend is actually called phosphatidylserine, or PS in short form. It is a phospholipid. I will type it here for you if you don't see that here. Phosphatidylserine. Okay, here we go. So this serves as an essential structural component of the brain in which it helps to form the nerve cell membranes and myelin, a protective shell that surrounds the nerve fibers. Although PS is not easily obtained through our food, PS dietary supplements commonly derive from soy or soy lecithin or sunflower lecithin are the available form for us to take. Supplementation with PS has been shown to support short and long-term memory formation. So if you tend to forget your keys in the morning before you leave, this PS supplementation will help you with the short-term memory. Also helps in memory retrieval, learning, and information recall, as well as reasoning. Very good herbs to have in your cabinet as well. Okay, next one we have is folate or vitamin B9. This is a water-soluble nutrient required for our brain function and development. Folate exists in several forms, which includes the THF, which is tetrahydrofolate, in food, and then also folic acid or L5, MTHF in dietary supplements. So food that are high in folate include, if you want to take them in food forms, like beef liver, green vegetables like the asparagus. We have broccoli, Brussels sprouts, mustard green, spinach, black eyed peas are some of them, avocado, and also kidney beans, which is very high in folate. Low levels of folate are associated with age-related cognitive dysfunction, and also folate supplementation prior to conception. Or if you're thinking of getting pregnant, you should start taking folate, and also during your first trimester of pregnancy to support fetal nervous system development, and also help to lower the risk of neural tube defects or NTDs. Okay, let's look at next one here. So some of you might have difficulty converting folate to its active form due to some genetic polymorphism or changes in genetic. So you may benefit from taking L5-MTHF, which is an active form of folate. If you can test for that folate deficiency or some sort of a gene deficiency, then this active form of folate will be better for you. I have two brands here that I like. I like this one by Designs for Health, and also Douglas Lab, which also have the active form of folate that you can look for. Okay, let's see. Next thing we have here is vitamin D. Okay, vitamin D is sometimes referred to as the sunshine vitamin. Vitamin D is synthesized in the skin from sun exposure. So we know that, if you have low vitamin D, you are much more prone to feeling sad, okay? And clinical studies suggest that low levels of vitamin D are also associated with cognitive impairment, as well as increased risk of Alzheimer's disease and seasonal affective disorder, especially now that we're going into the fall and winter season. So do take your vitamin D. And some folks, such as older adults, or some of you who have limited sun exposure, or have dark skin, have a limited ability to synthesize vitamin D. So that's when supplementation would be a good idea as well. So the safe amount you can take is 1000 IU, which is international unit a day. And you can take that every day during the fall and the winter months as well. And I like the brand by Pure Encapsulations and also by Nordic Naturals, which I carry here, also physician grade supplements. I think lastly we look at omega-3 fatty acids. Okay, so let's see here. Okay, so almost 60% of the human brain is comprised of fat. So omega-3 fatty acids, it is an essential component of the cell membrane structure. So imagine your brain, okay, 60% comprised of fat, and omega-3 is a very important role in brain development and also function. The long-chain omega-3 fatty acid has EPA and also DHA. This may be obtained through diet by eating oily fish. I like mackerel myself. You like that? It's not so expensive fish, easy to find. And also herring, salmon, or sardines. Or you can also take fish oil as well on top of that. Or I like also some sort of algae supplementation for this omega-3. So omega-3 has shown to improve cognitive in individuals with low level of omega-3 status, and dietary intake of omega-3 fatty acids may also help to prevent certain cognitive conditions such as, of course, our depression and dementia. The D and Ds, I call it. Depression and dementia. Okay, so omega-3 fatty acids, or eat some fish. The antidepressant effects of fish oil supplementation may be because of its ability to help reduce inflammation and directly act on cell membrane properties. So it really helps your brain to stay out of the depression mode. And two brands that I like here for omega-3 supplements are Finest Fish Oil and also Carson Labs. Carson Labs are one of those that I carry here as well. So eat your fish. If you don't like fish, take supplements. That would be much more helpful for you. And I hope this information are helpful for you to stay out of the sadness days during the fall and the winter months. And also, if you have taken a guess on my MEDS, I'm going to tell you my secret right now. So M stands for meditation, E stands for exercise, D stands for diet, and the last one, S stands for sleep. So this is my 4 tips that I do. I put it on my wall that I do every day to help me stay sharp and also happy. So MEDS, meditate, exercise, good diet, and enough sleep. So hopefully you will have a good October. And any questions, feel free to message me here on Facebook. I wish you a very happy mental health month in October, and see you next time. Take care. Bye now.